Greetings, this is the coronavirus COVID-19 update for 3/22/2020. And we start with the Chinese numbers from Baidu. Lower left we have cumulative cases, 81,604, up 102 from yesterday. That's mostly due to the addition of Taiwan and Hong Kong in the numbers for China. And overseas input, plus 39 cases coming from overseas, according to China. Nine new deaths today, so that's a pretty low number. Then we have, if you scroll down on the same page, there's a link to the Baidu site in the description below the video. This is a map of China, and what they're doing here is taking the province's total number of cases minus the recovered cases and minus the deaths to show you how many cases the province has, and all of these provinces are getting lighter colored every day. This is graph number one, what I call graph number one. If you keep scrolling down this Baidu page, you see 3 graphs. They're not all together. I put them together. This is total new diagnosed cases and total overseas input. So only 10 new cases in all of China, if you believe that, and overseas input 39. This is the second graph, which plots non-Hubei province and Hubei province, and then the national number, and they're all three basically the same now. It used to be more meaningful back before the beginning of March. And this is graph number 3, which shows the total domestic new cases, 102, total foreign new cases, almost 26,000. So you can see the rest of the world's not doing very well compared to China. And this is a graph or a map that they use for, displaying the number of coronavirus cases over the world. And it's never accurate. We have something better. And if you scroll down further, you can see a list of provinces. So you can see little spikes here and there. Guangdong province, the most populous province in Shanghai, way down south, right above Hong Kong. Beijing 10, Shanghai 10, Hong Kong 44. That's a lot of cases for Hong Kong. Fujian, coastal province, just opposite of Taiwan, and in Taiwan 16. Then if you scroll down further, you can see hot searches today. These are search terms used to find the top stories about coronavirus. So we'll take a look at these. First story, measures to increase unemployment poverty. Some of these people that were, rural people visiting the big cities to work construction and stuff like that, they have to have been hit pretty hard by this stay inside, because a lot of them didn't have an inside, or they shared houses in cramped quarters with other people. And anyways, there's efforts to help them out now. On the right, you can see a Guangdong medical team running off of an airplane, glad to be home. And they're wearing coats. They were in Wuhan. The last few videos I made showed a bunch of these. There were about 6,000 medical workers that came from the rest of China. Tianjin province were the first couple plane loads to go home to Tianjin. That's a coastal city where the big chemical explosion happened a couple years ago. And then now this is Guangdong people coming home today. This is the 3rd day in a row that we've had big medical teams leaving Wuhan, which is now clear of the virus, and returning back home. Then we see on the left Han nurses. Han, this translates, Han and Wuhan are the same, but anyways, these are nurses from somewhere that are in Wuhan and leaving, and this group of nurses was being saluted by the police, say, thanks for your help. All the policemen gave them a salute, and then some of the ladies shouted back, is anybody single? You can come home with me. Can I take one? That's what that meant. You had to read the story to get that. Hubei province again, outside staff back to Wuhan. So in addition to medical people, there were other staff people that visited Hubei province, and they're also returning. And then what do we have? A traffic jam on the left in Wuhan, which is something you haven't seen for a long, long time. People were like glad to see a traffic jam. And the guy on the right, Zhang Wenhong, he's an academic of some sort. Epidemic may last 1 or 2 years. And then we switch now to the global tracker. This is the Johns Hopkins global tracker. That's the de facto tracker for the rest of the planet. It's done by the Center for System Science and Engineering, a research institute at Johns Hopkins University, and they've been working on this and refining it for a long time. And other than the crazy graph on the bottom right, it's very useful. So you can see the new cumulative total here, the 335,957 cases worldwide, 14,500 deaths almost, and 98,000 people recovered. So some alarming issues that we see here. Italy, deaths 2 days ago, 4,032 to 4,800. That was a huge increase, a world record. And then now up to 5,476. In Spain, from 1,043 to 1,375, now up to 1,772, so they're up almost 400. France, 450 to 562, and now 674, up 100. And the first country that I want to look at every day now, I guess, is South Korea, because that's the model country. So if you look at the graph, these are graphs I made. The graph on the left shows South Korea compared to a bunch of other countries on the bottom: Italy, Iran, France, Spain, Germany, and USA. And you can see that they were just worlds ahead of people, increasing by the gazillions every day, thousands and thousands every day ahead of every other country in the world. They went from nowhere to being the epicenter of the coronavirus outside of China. It was just out of control. Now, if you look at the graph on the right, which is current all the way up through 322, it should be, or 321, I guess, it's pretty much flatlined. It's, they're at like 9,000 cases now, and they're getting very few new cases every day, a lot of recoveries every day. And, they did it because they're a model country. They did everything right. Everybody should be watching what they're doing. So the two older slides on the left, screen prints, China and South Korea models seem like the only way to contain COVID-19, and South Korea wants to show the world how to do things. The first thing they did is come out with, use the WHO information on this coronavirus, develop test kits, test people by the zillions, 15,000 people a day. They invented this concept of car drive up. Hey, you want to test? Just drive your car by this street and we're going to have a test set up. All you have to do is roll down a window and show your driver's license, and we'll take a swab of your mouth and you're tested. And then they went crazy disinfecting the entire country, everything, everywhere, streets and sidewalks, everything that they could, everything around them, below them, and to either side was disinfected as they walked by. So, and then these little kits, these quarantine kits that they passed out to people, they gave them food, water, and masks, and then this little box full of goodies. And this is the magic drug that they use to cure people, Kaletra, which is an American drug, which is a combination of two other American drugs, and that's lopinavir and ritonavir. And one's a malaria drug, anti-malaria, and the other one's a AIDS drug. So the combination of these two drugs in one pill called Kaletra, made by AbbVie, which is a spin-off of Abbott Laboratories, is, makes the drug that cured all these people in South Korea. Then news out of South Korea. Prime Minister urges religious entertainment indoor sports facilities to shut down for 15 days. That was out of the news yesterday. And today, they're starting to test all European arrivals as they get off planes, everybody that gets off a plane. So they test them, make sure they don't have coronavirus. Okay, just like most of these slides, if it's a really small screen, it's from the day before or maybe a couple days ago. So on the bottom left, you can see a video where a bunch of Italians made a video and trying to tell the rest of the world to take this seriously, because we didn't. 10 days ago, this is what we were doing instead of staying inside, and now the country's paying for it. And then we have that famous car or truck caravan, army trucks pulling up to a city in Lombardy, and filling their trucks with bodies in body bags to take them out of the city and burn them, because there was no place in the city to bury them anymore. Then on the upper left, we can see 627 dead a couple days ago. Yesterday was an all-time high, 793 deaths, which is crazy. China's worst day was still under 500. And then we have 651 deaths, today. And you can see the map there, the hot spot. The biggest hot spot is up in Lombardy province. And that's the mayor of Lombardy over there saying, talking about some smaller deaths today, death numbers. And then this is the bottom middle one. Here are the companies that can remain open. They shut down basically industry in all businesses in Italy. And they listed a list of companies that can still remain open. Okay, I've been putting Germany and France on the same page, and the reason is it's really hard to find information about Germany and France if you go to their big news services homepages or the coronavirus homepage. So the two stories on the top left are yesterday from Germany. The big aid package, $600 billion for, to help save some companies. 20,000 people infected in Germany. And then coming out of Welt, which is the world today, is South Korea, the South Korean model, Germany's rescue. It's about time somebody would use the South Korean model. I've been saying this for a long time now. South Korea is doing everything right. People should follow what they do. And on the right, why is the death rate lower in Germany, coming out of Spiegel? That means the mirror in Germany. In German, I mean in Deutsch. I used to spend a lot of time in Germany, so I can speak some German. Plus, I took German in high school and college. So this is an article saying, why is the death rate lower? Well, it's not. Their death rate's pretty high, actually, but it's lower than the two countries they compare it to, and that's Italy and Great Britain. Everybody's lower than Italy, and Great Britain's kind of out of hand, too, for their numbers. And then on the lower left, we have, this is a couple days old, where this French company came out with a new miracle drug that they say they have a bunch of dosages ready for it, and that it's quite effective. And the reason it's effective is it's the same combination of drugs that's used in Korea. So exactly the same stuff. Then French Parliament declares a health emergency, and on the right we have 800 patients in France in COVID-19 drug trial. So this is the big news coming out today of either country, is that both of these countries are going to be part of a big, huge European clinical trial. And it'll be France, Belgium, Netherlands, Luxembourg, United Kingdom, Germany, and Spain all together. And they're going to start doing a clinical trial on a list of drugs from the WHO that are all promising drugs. So that might include that French drug on the lower left, and might even include the American one, even though it's kind of proven itself. So we'll see. That's a big, huge clinical trial, and hopefully it doesn't take too long. So this is Iran. I thought about pulling Iran out of here a zillion times, because the news coming out is just crazy, crazy stuff. It's for weeks, they're saying that the U.S. sanctions on them is, affecting their ability to fight coronavirus. Well, how? How is that, And Then they're pleading with the international community to pressure the U.S. to drop the sanctions. You have sanctions for a reason. You send a general into Iraq to team up with some terrorists and kill people at the U.S. Embassy because of 4 or 5 days of attacks in a row wasn't doing a very good job with the terrorists, so you sent the general in there to help them. And then the U.S. killed the general, okay, with some really cool little miniature missiles. And then you shot down a commercial airliner the next day, Iran. So that's why you have sanctions. Nobody's going to drop your sanctions. The reason you have a big issue is like the lower left, this big, pilgrimage you had with all these people packed into a site with like sardines, sleeping together, eating with their hands, staying in hostels where they're bunking up together in bunk beds and eating, going to the bathroom together, everything together. And people here licking the shrine to show that they're not afraid of coronavirus, which they're all going to be in prison pretty soon because they found them all. Anyways, the news out of Iran today was the U.S. offered aid in the way of drugs, and they're saying U.S. proposal for medical aid may be conspiracy because the United States, may have created this virus in Iran. Or maybe not. We don't care whether you want the drugs or not. Pass them out to your people. We don't have anything against Iranian people. We hate the same people that they hate, and that's the leadership in Iran. Okay, what else is going on here? So this is the U.S. U.S. not looking good at all. From 25,000 cases to 33,000. So that's up a boatload, that's just totally out of control. And, there's 4 really hot areas in the United States, and other areas pretty much have things under control. Look at the San Francisco Bay Area. They're pretty much have things under control. So we have the state of Washington from 1793 to 1996 up a couple hundred. New York, 11,710 to 15,000. They're up 4,000 in New York alone. And I think that's the city of New York. California, 1364 to 1642. And New Jersey, 1327 to 1914. I just started tracking New Jersey because it's like the 4th biggest hotspot now, and it's kind of rising above all the other cities. And 417 deaths altogether. 178 people recovered in the United States, which is one of the lowest numbers you'll see in the world. Why? I don't know. We're not using our own drugs. Okay, Washington. Yesterday's news, no immediate plans to expand virus restrictions coming from the governor. Trump approved Washington's emergency disaster plan and the use of the National Guard. Then a manufacturer on the upper right, it went from making couches to surgical masks. That's good. The whole country needs some surgical masks, but they probably did that because it probably has something to do with profit margins. And this lady in the middle here is a high-end doctor. Test numbers don't reflect a true scale of outbreak in Washington. And, she's probably right because we're still way behind on testing in Washington. The big news coming out of, earlier in the week, lower left, is the vaccine is under clinical trial now, and it started on Monday with 45 people. So this is good. There's a, American-made vaccine, and hopefully it'll prove to be a very good drug, and we'll immunize ourselves using that. And then on the lower right, local officials urge social distancing as trailheads, beaches swarm with people. So this is, in Washington, the whole state is not infected. It's mostly the Seattle area, and it's most of the infections in the Seattle area are the 3 counties south of Seattle. And, but still there's got to be a lot of people out there walking around with coronavirus. And, this doctor thinks the same thing. There's got to be a lot more people out there. She doesn't believe the numbers. Okay, this is California stories from yesterday. Governor directing $42 million in emergency funding. First weekend of the stay-at-home order. The governor ordered everybody go home, stay home before the weekend. And, this was the first weekend of that order. They're just trying to see how it goes. And it's going pretty good. And then lower left, a 34-year-old died and made the news. And, he's a healthy 34-year-old guy, and he died just a couple days after he got, diagnosed with COVID-19. And then what do we have new? LA, other Southern Cal cities cracking down on crowds at parks, beaches to stem the spread of COVID-19. You could see this is it's raining, but this is a beach. I forget what beach this is. Can I see? No. Anyways, a big beach, closed down, and they're urging other beaches to close down too to people. And on the right, you can see a map of California with the counties, and you can see where the hotspots are. So you have the San Francisco Bay Area, which is, pretty much under control, except for the South Bay, and that's, I think, can't see very well from that map, but it's probably the county that San Jose is in, way down in South Bay, 302, where a lot of those counties around there are still in, the teens and 20s and 30s. And then LA County with 409, 159 down by San Diego. So California, they have a zillion cases, but it could be worse because it's a really big state. We're talking 40 million people in the state of California. Then we have New York. So old news from New York, Cuomo warns young people, that a lot of the cases that are coming up now are people under 40. That's where the majority of positive coronavirus tests are popping up with people under 40 now, or under 50. New York weighs in 4 temporary hospitals. A lot of big buildings, convention centers, or stuff like that are being considered to make into a hospital. And you've got the National Guard on the way, so that's good. Tri-state, this is confusing stuff. This is why I put these other maps in here. It's confusing to the Channel 4 in New York too, NBC News. Okay, so they say tri-state sees 174 COVID cases and 19 deaths in addition to, today from yesterday. And then on the right, New York's entire workforce must stay home. They're cracking down on this. They still see a lot of people on the streets walking to work, or, public transportation isn't being used. It's being policed pretty well, but people are still getting to work. And then tomorrow they make this announcement. This came from the news. Closing by 8 p.m. tomorrow. And they said the entire tri-state area. So, I've worked a lot in New York, and I know what the tri-state and tri-state areas are, but the news service doesn't, because Pennsylvania is never included in the tri-state area. That would be 4 states. So if you're talking about the entire 4-state area, you're talking about New York, New Jersey, and Connecticut. Okay. Then we have, on the bottom here, there's a little map. I just Googled tri-state to see what it is. So what they should have been showing you is on the right in the red, New York, Connecticut, and New Jersey. That would be the entire tri-state area. But the immediate tri-state area, which is the greater New York area, which is population 19 million, which is New York and all of its boroughs and Long Island. And then you have the coastal areas of New Jersey, and then you have the southwestern part of Connecticut. And all of these cities are really, really close to New York City. That's why they call this the tri-state area. So that article on the top, the tri-state sees 174 COVID cases. That's what they're talking about. They're not talking about the entire state of New York and the entire state of New Jersey. And then on the right, so the news doesn't even get it right. They throw Pennsylvania in there for some reason. And then on the right, there's an interactive map of New York, and that's really the best way to get the news, because I don't see any specific news for areas in New York that account for these 1,500, almost 16,000 cases now in New York. So you have to just slide your cursor by all of these little boroughs, like, the Bronx 9,000, Manhattan's 9,000, a lot of, Brooklyn's 9,000, all of the, boroughs of New York, are around 9,000. So that's how that adds up. Then what do we have? New Jersey. I just started tracking New Jersey. News out of yesterday. 4 members of the same family died from coronavirus after a bunch of them tested positive. And then we have a guy arriving from Aruba who's an American citizen who came into New York on a private jet with a private little, virus pod. And, they sedated him before he went, so he slept for the whole trip because it's kind of claustrophobic looking thing there. Then what do we have? 590 new COVID cases, 4 more deaths. So that's a lot of cases for New Jersey. New Jersey's up, to 2,000 cases now. That's why it's it's another epicenter in the United States, as big as Washington. Then what do I have? A bigger just news, So this is national. This afternoon's news, coronavirus updates. Angela Merkel quarantine, the German. I didn't go over that under Germany because she's just basically staying home because she was seen by a doctor that tested positive. Rand Paul, who cares? Ohio on lockdown. So this is a little, different from Ohio because Ohio doesn't have that many cases. They actually close all bars and restaurants when their number of cases was way under 100, like, 27 or 30 cases. They close all bars and restaurants. And now it's, total lockdown, and there's only 300 cases. Upper right, Canada, Australia pulling out of the Olympics. So that's kind of shocking. We don't know what's going on with the Olympics. They could be postponed until this fall. But, in Australia, in UK, we're going to be one team, UK, Australia. So I guess England's, or not England, the UK is going to have their own team now, like they used to. Majority of New York COVID-19 cases are people under 50, so it's under 50. And then the Ohio governor's announcing a total lockdown. Don't be outside unless you need to be outside. And the WHO announced that there's at least 20 coronavirus vaccines are in development now. And this is a picture of a lab in Israel. And also news coming out of China, antiviral treatment called remdesivir, made by U.S.-based Gilead Sciences, is already in the final stages of clinical trials in Asia, and the Chinese doctors have reported it's proven pretty effective. So that's really good news. This is the drug that was given to the first American patient who was near death overnight. I have another video talking about this, and instead of looking up all the dates again from the first case, the New England Journal of Medicine did a study on the first case, and I just read their study and snagged about 20 screenshots from their study. So this is like day 7 of his sickness. The evening, he came up with pneumonia in one lung, and he was in bad condition. And his oxygen numbers were way down, and they asked to use this drug, and they gave it to him, and the next day he recovered. The only symptom he had the next day, his pneumonia is gone, all his other symptoms. He had a cough. Like, when you get over the cold, what do? You cough for a few days. So, it's a pretty effective drug, and it's in the final stages of a clinical trial. That's really good news. Okay, this is a graph I made for the USA, the American numbers. If you take a look at from 312 on, we're accelerating in the number of cases every day. This is maybe not a exponential curve, but it's a geometric curve. It's not a flat line. This red dotted line kind of shows you the trend. And, it's just getting out of hand. We're getting more and more cases every day. It's accelerating. It's, you can almost predict what tomorrow will be, and it's all bad. Then one more graph, the final slide here. I made this graph on Italy, South Korea, Iran, France, Spain, Germany, and USA. And if you remember this graph from the South Korea section, they were just getting out of hand. It looked like everybody in South Korea was going to die because the big, huge leaps every day in the number of cases due to that church being out of control. But now their tests became available. They developed their test kits really fast. They tested everybody. They invented drive-through car testing 15,000 people a day. They disinfected the whole country to cut down on community, transmission. And they're doing everything right. Plus, they're using the right drugs. They're 9,000 cases now, a couple thousand recovered, and only 105 deaths. They're really the model country. Every other country should be following the South Korean model, and we'd be over with this stuff. Okay, that's all we have. Appreciate your time.